On behalf of the Ministry of Health, allow me to welcome you to the first conference on health investment opportunities in the oil and gas region. I take the pleasure to thank all the organizers, especially the Petroleum Authority of Uganda and other facilitators for this event in the health sector and in the oil and gas sector. The health system contributes to the third objective of the National Development Plan, which is to enhance human capital development, focusing on increasing access to quality health services. The sector is working hand in hand with the private sector to expand the scope of services and the coverage in the country through the public-private partnership for health policy. Progress has been registered in major health indicators over the years, but gaps still exist, which can be filled through strong partnerships and multi-sectoral collaboration. In the Health Sector Development Plan 2015 to 2020, the role of the private sector in the transformation and reform of the health sector is key. As from the various surveys, the private sector contributes between 45 to 50% of the health services in the country. This conference, organized by the Ministry of Health and the Petroleum Authority of Uganda, is a timely event for private health providers to exploit the endless investment opportunities in the health sector, particularly in the oil and gas regions. A needs assessment of healthcare services was carried out by my ministry, and a report is present which indicates wide health service delivery gaps not commensurate to the requirements and the demands of the oil and gas sector. In this region, there is a huge influx of people of all categories. So we are not only looking at the high-class people, we are looking at categories of people from the lowest level to the highest level. And so that region needs both strengthening of primary health care and tertiary health care. The Ministry of Health will provide leadership and guidelines and better business environment, focusing on partnerships in health, on the emerging opportunities in this region. To further strengthen coordination and collaboration, the Ministry of Health has established a department for private sector coordination and a technical working group where such matters are discussed. We look forward to building this partnership to greater heights, where aspects of joint planning, quality assurance, innovations, research, and capacity development can be discussed. I wish to thank all private health providers in the country for being reliable partners, and we look forward to a new mutual collaboration and accountability, especially in the oil and gas regions, beginning this financial year. I urge all private providers to link their medical record systems to the Ministry of Health Health Management Information System to ensure that we have this information for better planning, because sometimes you attend to huge numbers of populations, but it's difficult for us to plan for them when we don't know about them. The Ministry of Health will always be available to support you in any health investments where we can and with our capacity. Once again, I want to re-emphasize the fact that government is interested in investors and in the private sector. Our plans need to be plans with good rates of returns on investments. Lastly, once again, I welcome you to this first conference, meaning there will be several other conferences thereafter, where we can even discuss much more on the progress that we have made.
The oil and gas sector has an impact on the health sector in two ways. The first way is where it needs the support of the health sector in order for it to be effective. The other way is in the manner in which it brings opportunities to the health sector. So it is very important that both aspects of the challenges and the opportunities are embraced, so that when we address the challenges, we can help the oil and gas sector move well and quickly and efficiently. When we address the opportunities, then we enhance the health sector and definitely therefore a contribution to the economy. So that aspect of health, the Petroleum Authority realized that the best way to take it forward is by engaging first the Ministry of Health to see what exists on the ground and what needs to be done. And then secondly, engage the private sector, who are definitely very important players in both the oil and gas sector and in the health sector.
My name is Sega Ronald Jagenda. I can only say that I'm happy to be back home. Some of you know very well that we started this journey together, only that I temporarily departed to another ministry. I'm privileged to join you once again. So since we have already lost time, I would request that we officially commence by receiving the first presentation. And I think this is from the Executive Director of the Petroleum Authority of Uganda. You are welcome, Ernest.
Mr. Under Secretary, nice to have you back in the sector. And I would like to call you Ronald, the way we used to call you before, which is very good. The Executive Director of the Private Sector Foundation, representatives of the oil companies here, all invited guests, my colleagues from the Petroleum Authority of Uganda, distinguished ladies and gentlemen. I would like to welcome all of you to this first inter-sectoral conference between the oil and gas sector and the health sector. The Petroleum Authority of Uganda is very delighted to have organized and to host this conference in collaboration with the Ministry of Health and the Uganda Health Foundation. This is a joint effort, and I'm very glad for the results it is bringing in terms of participation, but I have no doubt that we are also going to see much bigger results on what we take forward after this conference. The mission of the Petroleum Authority of Uganda is to create lasting value for the Ugandan society and to contribute to Uganda being a sound investment destination. The main objectives of the conference today is to discuss the health investment opportunities in the oil and gas sector, and I must admit, also to discuss how the health sector can help the oil and gas sector, because the oil and gas sector is going to take a lot of people in the Alberton Graben and along the pipeline route, and I think the presentation from the Petroleum Authority will describe these details. And when these people go there, they will need health facilities. And it is important that the Ministry of Health and the private sector part, the Uganda Health Federation, go to those places and actually put these facilities there. The beauty about these people who the oil and gas sector is going to lead into those places, many of them will not be looking for free health services. They have the capacity to pay for the health services. The conference has been divided into 3 parts, as the moderator was saying, and it will feature presentations from key stakeholders in the health, of course including led by the Ministry of Health. Really, we're very glad that the Ministry of Health is here in full force to lead these presentations. It is also going to include presentations from the Petroleum Authority of Uganda, really to bring everybody up to speed on what we are talking about in the oil and gas sector.
Ladies and gentlemen, I think we should proceed with the next presentation, and after that we shall agree on how to proceed. So can I request the next presenter, who is now the Executive Director of the Private Sector Foundation? Please, you are welcome.
First of all, let me appreciate this time that we are all together this morning for a very good cause, and appreciate the work that is being done by our partners in the oil industry, by our partners in the Ministry of Health, and all the other sectors to help us coordinate better and think together in a more progressive and yet constructive way. I thank you, all protocols observed. Thank you so much for this morning. The oil and gas sector is one for which many Ugandans have developed very, very high expectation by way of investments, job creation, and income growth, and both the private sector and government have been excited about this development in the sector. A lot of engagements have occurred at various levels, and I'm looking at the exploration, I'm looking at the development stage, I'm looking at the construction stage, and later at the production stage, between government, the investors, and the communities in the region that we call the Albertine Graben. There have been a lot of engagements, and we want to appreciate Petroleum Authority of Uganda. We want to appreciate the Ministry of Energy and the entire government machinery on the production sharing agreements, on the final investment decisions, which I think now we begin to see light at the end of the tunnel. These are more or less concluded. There have been protracted debates, discussions about these things, all of us know. Back and forth, really, to be sure that, given the fact that it's a new environment, we are venturing into a new environment, we do not make mistakes. The authorities have also estimated that with the development, the construction, all these things across all phases, we're likely to have in excess of 160,000 jobs. And these will be direct, they will be indirect, they will be induced across the board. Now, of course, this begins to have a ringer on all of us, not only for the health sector, but for transport, for hotel and accommodation, the tourism industry, for many other sectors. So if this massive employment is coming and brought in by the sector, the question would then be, how ready are we? And we have been asking this over and over again. A summary of some of the healthcare investment opportunities that the private sector may take advantage of would include: one, provision of the health insurance. There are many people that want to register health insurance. So AAR, IAA, I don't know who else and so on, can take advantage of that. Provision of emergency response services as well, ambulances and so on and so forth. Dispensing of medicinal drugs, dispensing. Investment in treatment centers. And we have said we have a very low hospital bed, what do you call it? Bed-patient ratio or something. It's very low. And so we cannot do admissions quite easily. And this is again another area of investment that the private sector can identify and take advantage. Training of health workers, training. Health training institutes. How many are they? Where are they? Who are these health workers? Where are they trained? And can the private sector invest in this? And the answer is yes. Counseling and palliative care. Counseling. People want counseling. HIV, cancers, terminal illnesses, and so on. These are all areas, all opportunities for investment by the private sector. Already, we appreciate there is an enabling environment. Enabling environment is there, but as I said earlier, we need to address such aspects as capital to be able to engage and put money in these investments. It's about identifying opportunities and taking advantage of these opportunities, and then asking the question, does it make business sense for me to get into there?
Ensonga y'ebyobulamu yeetaagisibwa nnyo. Twalambula Petroleum Authority ne Ministry of Health nga ne Minister kwali n'abakungu abalala mu Ministry ya Health ne tulambula okulaba amalwaliro ne clinic ziyimiridde zitya. Twogera ku bantu emitwalo 16 abagenda okukola mafuta. Kati abantu emitwalo 16 egyo twalaba nga amalwaliro agali mu Albertine Graben gye gali kale naye first of all gayinza okuba nga tegamala ate n'omutindo gwe galiko gusobola okuba nga tegusobola kubanga kati mu mutindo njogera ku bintu nga equipment oba laboratories ezeetaagisa abasawo abeetaaga obumanyirivu obukugufu okubeera nga basobola okukola ku bantu bano. Kale mu kulambula okwo twakizuula nti ebintu bingi birina okukolebwa. Ministry ya Health erina okumakinga sure nti tukolaganira wamu okulaba nti amalwaliro gano gasobola okuba nga gatuusibwa ku standard. Ate tutunuulira n'abantu kinnoomu ba private providers bayinza tuyamba batya kubanga mu bintu bino tulina okubeera nga tukolaganira wamu ffenna. Just briefly on what the kind of resources we have in the country. We have 21 oil and gas discoveries. Through the exploration phase, we have been able, we talk about 88% success rate. The works involved in oil and gas are very risky. You've heard about a number of countries going into this and failing to find, but as far as we are concerned, we talk about 88% drilling success rate. In terms of the oil in place, we have 6 billion barrels of oil, and we have 500 BCF quantities of gas. We have 9 production licenses that have been issued over 14 discoveries, and these have been issued to CNOOC, a Chinese company, Total, E&P, French, and Tullow Oil. We have 3 exploration licenses that we have just issued to 2 companies, 2 of them to an Australian company called Ama Energy, and 1 to a Nigerian company called Oranto Petroleum. It is very important for us to note here that only 10% of the Albertine Graben has been licensed. What this means is that there is still a lot of potential. The area that has been earmarked as potential to have petroleum has only been discovered. 10% of that area has been licensed out to different investors. So there is a lot of potential as we talk about 6 billion today and 1.4 billion recoverable. There is still a lot of potential. The total expected investment is $20 billion US. But what does this mean to the country? The biggest projects we've had, we had Karuma Power Project. It was just only $1.7 billion US. And that was a very huge, I think it's one of the biggest projects we've had in the country. Also, Bujagali, that was $860 million US. So if you try to put this into perspective, looking at the $20 billion US that is coming, it is a huge opportunity. We were given statistics, the keynote speaker still gave us statistics, that the physician-patient ratio at the moment is 1.5 to 1,000. That is an average for the country, but what is it for the Albertine Graben? What is it for the export pipeline, where the 10 districts where it's going to pass? It means a lot in terms of the needs. We need to highlight, we need to come together to see what we need to put in place.
And so we invited many people here, including the private sector, to discuss with them the investment opportunities and to encourage them to join us in the oil and gas region so that we can plan together for better health services for the people that are moving into that area, but also for the people who will come to offer services in the oil and gas industry.
I am the Chief Medical Officer for Total now. I have been the CMO for 2 years, and here is Dr. Professor Biakika, who is my advisor, also for many years now, and I'm very pleased to have her on board. So my mission here today is to introduce some guidelines and specifications regarding health support for oil and gas. It is very clear, and I try in 20 minutes and with you 40 minutes to explain guidelines, especially for occupational health, and after me for emergency procedure for oil and gas. Could you introduce yourself, maybe, Dr. Biakika? Maybe people did not know her, but I think that it will be fine.
Okay. Good morning, everybody. All protocol observed. I'm Pauline Biachika Chibwika, and I'm the company medical advisor for Total and Talo Oil. And I've been in the industry for over 5 years now. So the purpose of health services in the oil and gas sector is to improve performance and well-being of workers, and in doing so, to manage the risks to health and safety. Safety is embedded in the culture of the oil and gas industry, and it is a serious concern. The sites in the oil and gas industry with a well-developed health and safety culture show higher levels of worker engagement and enjoy more sustainable health, safety, and business performance outcomes compared to the others. Investing in the health and safety of staff is legislatively mandated and can provide a solid return on investment for a business, any business. So 2 main mechanisms in which health interventions contribute to a business overall business performance, and these are reduction of a company's costs stemming from production loss due to illness, medical bills, insurance premiums, substituting staff due to ill health. And secondly, comes indirectly from staff performance, health, and well-being. So by instituting a health and safety culture, the business actually gains. A series of interventions implemented in projects at one company consistently improved business performance metrics. 30% above average hands-on tools time, 4 times improvement quality in welding, 60% fewer unsafe acts and conditions, and a significant reduction in total recordable cases. So the oil and gas industry endeavors to minimize any health and safety incidents occurring. Standards showing similar returns on investment from health interventions were published by the Harvard Business Review and the Journal of the American Medical Association. And the Rand Corporation put the return on investment of $3 for every dollar spent by businesses on disease management. These examples show the clear business opportunity that good health management provides, hence the need for investment in health.
Just to remind you about my profile, so I have been the Chief Medical Officer for Total for 2 years now. So during 2 years we did many things, MOU with some clinics. We are trying also to have MOU with public sector. Also at the same time, and now we are acting for improving Buliza Hospital regarding the response to the Ebola outbreak. We are also in contact with Oima Hospital. And since my arrival, I did surveys from Tonga to Oima to see all medical facility. And after that, we have like a rough revision about the needs for medical support for oil and gas. So now the principle of medical emergency management. We have 4 levels of medical response, Tier 1 to Tier 4. Each level has particular requirements regarding staff qualification, equipment, expected treatments. Tier 1 and Tier 2 are in the field, and Tier 3 and 4 in big cities. Agreement with national regulation, of course. Madam the Minister, we count on you to work with you and also to agree about this level of medical facilities. And official documentation to be released, MERP, that means Medical Emergency Response Plan. For each site of our operation, we have this kind of plan. In case of any emergency, we have all the contacts, all the provider, we have means of transportation, and also all the contact also with managerial and also government in case of for example, mass casualties.
A lot more resources can be invested into tertiary healthcare services, which include super specialized services and other specialized services for the region. And that is why it is important for the private sector to come on board and join us in this endeavor.
Ugandan doctors can do what I saw there. They just need to be orientated to specifications for Total. And there are 2 courses at Mackay University and Bara University which have just started, where Total and others can invest in emergency medicine. The 3rd issue is that there is a conference coming up on emergency. And I think this is an opportunity for the industry players to support our practical. I just had those remarks. I had very many complaints, but after your presentation, I'm happy that we are moving together. Thank you very much.
So I ask a question that is geared towards patriotism, and this could go to the Honorable Minister or whoever will choose to answer on that panel. As you have seen from Dr. Pierre's presentation, for a Tier 2 sort of facility, you're going to need paramedics. And what I've seen in this industry world over is paramedics are quite popular in this industry because of the way they can be handy and what they can do. However, the sort of paramedics that are needed in this industry, and Dr. Pierre will side with me, are what they call advanced life support paramedics. They can do the ATLS, advanced trauma life support, and they do the advanced cardiac life support management as well. So the Right Honorable Minister, to curb this unemployment and all these people that have been trained, we know that our curriculum here does not incorporate such sort of unique standards that are required for oil and gas, like emergency medicine, advanced cardiac life support, advanced trauma life support. What does the ministry have in plan to make sure that the products of paramedics that we have in our system are employable by the oil and gas industry that has such very high standards?
It saddens me if we are planning to evacuate people from the Albertine region and through Entebbe to Nairobi. We have competent medical people in this country. Maybe where we may be incapacitated is in the equipment and facilitation. With the level of investment which we were told about, Nambulo I think talked about that, can't we probably set up, even if it's not a large-sized facility, or can we set up a medium-sized facility, equip it, and then have our doctors and other specialists on the ground, other than taking them to Nairobi? I think that is one of the feasible ways. And then lastly, for the companies like Talo, Total, in as far as social, corporate social responsibility is concerned, what have you planned for the people of that region and the neighborhood? Plus the pipeline districts. Somehow I think, one of my home district is Chotera which happens to be a pipeline district, I get excited. But what have you planned for the pipeline districts? I need to know that.
Okay, thank you very much.
The issue of occupational health and safety is paramount. We have had a lot of workers who have been injured, physical injury, chemical events from the different industries, factories all over Uganda. I'm glad that in this meeting, a lot of emphasis has been put on occupational health and safety. My question goes to Professor Byakika. You did allude to the conventional health issues, but oil, gas are prone to big explosions. Could you say something about the preparedness for chemical events, chemical incidents related to International Health Regulation 2005? I think if you did that, the core capacity which has been built by the companies. Of course, coming from the academia, we also position ourselves to enter into partnership on research, on training. I'm glad that the opportunities which were alluded to early this morning cover a lot of this. So I think during the networking, I will be approaching some of you individually. Thank you.
Thank you very much.
Next, two questions. One, I think, goes to probably the minister. Currently, we do not have a certified training facility for ACLS or ATLS in this country. And that means for any Ugandan doctor who wants to touch any oil and gas patient, right now, they have no way to be trained in this nation. They must travel to Dubai, or they must travel to South Africa, or they must travel to Nairobi, or those who have money can, like Dr. Book, can go to America. Now, as an emergency, which means right now, we are not really able to participate, yes? Can the Ministry of Health set aside maybe a fund, an emergency fund, to train at least 1,000 Ugandan doctors, yes, in the next 6 months? ACLS, ATLS. Those people will be ready to work. So that is my appeal or my question to the ministry. Or we invite the trainers and we do it in the next 6 months. You can see we have very little time. Now, as an investor, I'm also an investor in Uganda. I want to ask this question maybe to Dr. Pierre. If you had right now X amount of money and you want to be in the health space in the oil and gas industry, where would you invest that money? Would you buy ambulances? Would you do equipment? Would you set up a hospital? Because as you've seen, and I've visited their clinic, it is really a high-level facility that some clinics in Kampala don't have. I visited his clinic. So their principle for sure is stabilize that patient there, move 2 kilometers to the airstrip and fly to Nairobi. That is how it is set up, yes? So will it make sense, for example, for me to set up a clinic in Bulisa? Yes? Will it make sense, or it will be Potea because you'll just fly over it to Nairobi? Thank you so much.
For many of these infrastructure projects, many times these people come, some of them foreigners, and they have children with the communities around and live. Where will it be catered for? At what point will it be catered for that when these people leave these children in these communities where they've left, these children will be catered for in terms of welfare after they've flown out, if they are foreigners, to ensure that their life continues. Still related to that is, how are we preparing this community to receive the 1,300 people and be able to prevent contracting diseases like HIV and etc. from these guys when they come and stay in that community?
I think the let's move like, if you start from Nambiru, the Honourable Minister will be the last one. The other round? Okay. I've been advised that the Minister will start, and if there are those she has not answered, then the referents can also come in. Thank you very much.
A quick observation before I go to respond. I noticed that many of you may not have visited the oil and gas regions. So your questions are coming out of assumptions. You need to go down on the ground to see what is actually there. And then we shall have a better discussion next time the Petroleum Authority and Ministry of Health organize a conference. But I'll go direct into the questions, and some of them I will combine. First of all, we have to take note that when you are beginning a new area, or when you are doing something, you must have a plan. You just don't start from the blue. And the Ministry of Health has the mandate of taking care of 40 million Ugandans. So we are not just going to put a clinic somewhere just like that. There must be a plan, and a plan that is sustainable, and a plan that is sellable. And why I say plan that is sellable, it is because we don't have all the resources. We run a cash economy. All of you listen to the budget speech every time that it is read. And all of you know about the health sector. You're very much aware about the different partners that contribute to the health sector. So when we are going into such a venture, we must have a plan. And you can only execute based on the plan, and then it answers your question of monitoring and evaluation. You cannot jump into monitoring and evaluation before you even have a plan and a strategy. And so regarding the advanced life support paramedics, I want to assure you first of all that we have already developed a policy and a strategy for emergency medical services. Right now it is before Cabinet. It will be approved in the next month. Once it is approved, then we begin implementation. In that plan, there are various collaborations with various training institutions in different countries to come and support us, because it is an area that we have not had developed in our country, as you correctly observed. However, also please take note that our own universities, Mbarara and Makerere, have started training in emergency medical services. The teams in Mbarara, I think, are in their second year, and Makerere has just begun a first year. We are very much cognizant that they will need hands-on expertise, and that is what we are working on to support. I will encourage all of you to read the policy and the strategy, because if I delve into it now, it will be endless. But that is a good concrete plan. If you ask me the cost of the plan, it is enormous, if it is to sustain 40 million Ugandans. So that answers the private investor who thought about going to put a facility in Bulisa. First, I urge you to go and visit Bulisa. Secondly, come back and we have a discussion before you put a high-level facility in Bulisa, because you cannot begin climbing the tree from the top, you need to climb from the bottom. And the majority of the people moving into the oil and gas area, that's why I'm saying you need to visit that place, then you start thinking about it. Total has been in business for several years, many years. They have developed a system. We are beginning to develop a system. So you develop a system from the bottom, not from the top. So don't start imagining super special whatever. You will fall from there, and there will be no ladder to hold you down here. So lay the foundation and move step by step. So regarding the certified training facilities for the ACLS and the ATLS, and putting aside emergency funds to train the Ugandans, all this has been incorporated into the emergency medical services. It would be very unbalanced of me to put aside money to train 1,000 Ugandans now, and then I don't deploy them, as I have trained so many health workers and you're not deployed, and then you lose skills over the years. There must be a plan as to where you will be deployed. There must be equipment and services that are running smoothly for you to execute your duties. So begin from a plan. How can the private sector come on board? A beautiful question. I think we have been in discussion with the private sector for a long time, and you have a representative who sits on many of our policy making bodies, and they're here with us. First of all, take note that in our discussions with the private sector, we developed what we call a public-private policy for health to guide our collaborations, following the PPP bill that was enacted by Parliament. Now, our policy gives guidance on how we collaborate. Secondly, we have a full department now for collaboration of the private sector, because we know the importance of the private sector and we know the contribution of the private sector towards health. So when you link up with our department through your various representatives, then you will get guidance on how to move. We welcome discussions with the private sector on areas of investments, and we have been having serious discussions on this with potential investors who have approached us, and we have guided accordingly. We have also discussed provision of a loan for the private sector. We have concluded all this, and next is only waiting for finance to start having this revolving fund for the private sector to grow. So you have great opportunities. Great opportunities to contribute to better health and better quality of health for the population. Now, allocation of 7.6 billion for kidney care in regional referral hospitals. Again, I appreciate the big dreams, but as I said, the big dreams need to go with a foundation and a base. Beginning kidney care in the regional referral hospitals requires that the hospitals have the infrastructure and the capacity to do it. 7.6 billion is a drop in the ocean. That is the amount of money we are giving the regional referral hospitals for their recurrent costs. So if I divide this by 14 regional referral hospitals, I'm not a good mathematician, but you can get you see the amount of money. That is poor planning. So the first planning has to begin with improving on the infrastructure, on the equipment as you're doing the training, so that you can begin the services. And government already has plans to improve on the regional referral hospitals, including setting up intensive care units. So hopefully by the end of this calendar year, the equipment for all this will be in place, also as we train the people. Then we can send there the 7.6 plus more, so that the regional referrals can work to the capacity that is desirable. Lastly, to the CEO of Digital Health, thank you very much for your question. Ministry of Health has plans on this. I don't know whether you participated in the development of the policy and the strategy for e-health in the sector. It was concluded. It is also before cabinet. Now, in that policy and strategy, we capture everything to do with digital health and digitalizing our health system, including telemedicine. So the plan is in place. I know you are a business person, but for us, we are thinking about 40+ million people. And so we move step by step. Chair, I think I've exhausted my questions.
Thank you very much. Can we clap for the Honorable Minister?
Thank you very much for the question. Yes, I will answer roughly for all the questions. And one of the questions which is funny is it is about where to invest. So, for my opinion, as if you talk, if I am talking to you as a businessman, it will be probably to pre-hospital care. That means to provide good ambulances with good crew, with also the medevac capabilities by road or by air. Yes, because you will have a turnover. Because here in Uganda there's a lack of pre-hospital care. That means people can die for a road traffic accident very quickly because no stabilization before going to hospitals. And for the operations also, for companies working for oil and gas, for mining companies, or for road building companies, also you can have accident. Maybe with insurance you can also provide pre-hospital care very rapidly to companies. And now for as a doctor, because mainly I am a doctor, the sector which is the most has the most cost is ICU. It's very expensive to maintain someone in an ICU bed, because there are so many devices, so many drugs, so many competencies also to follow up the case, to decide what to do every hour, every 2 hours, and also to coordinate all the people. It's very high-level competencies. That means you have to invest on training people, to import devices, to be at the standard regarding all the devices, all the procedure. That means a continuous training every year to send your physicians outside to see what is actually happening, updating knowledge and everything. The cost is very high. This is why I can easily understand that here in Uganda there is a lack of ICU beds. Maybe the insurance can also invest in this kind of service, but we have to work on a partnership between insurance, between private clinic or public sector also to improve this kind of service. Now, regarding the community health support, it is a very huge matter. So, regarding Total, we have a societal department who did the ESIA evaluation validated by the government. So, inside this plan, we had implement mitigation actions to reduce the risk, HIV, TB, outbreaks and everything. So all the details are inside the plan, and we cannot simplify things. You come at Buliza district. Okay, what do you do for Buliza? It is not like that. It is we have to go through the Ministry of Health, because it is up to the Ministry of Health to coordinate all the actions. It is an Ebola, it is the same. I am in contact with the task force for Ebola. It is not Total who directly provide things, medical items or money or everything to the district. It should go through directly the Ministry of Health, who is the leader and the coordinator of all these actions.
Thank you. Pauline, anything?
Thank you very much for the questions. I'm going to just answer some that have not been tackled. Regarding Dr. Alex Opio's question regarding safety, explosions in the oil and gas industry, I'm not the right person to speak about this, but all I have to tell you is that the companies have safety embedded, and safety comes first. For this particular presentation, we only concentrated on the health aspects and a few safety aspects, but those that are to do with the actual oil and gas operations have a different department that caters for that, and I must assure you that this has been catered for, and we can give you more information outside here. Just to talk about, there's Herbert in the room. There's also Ismail Nsereko in the room, who are more versed with the safety components of the companies, and they could, if given a chance, they could talk about that. But to go ahead, I would also like to speak about the question on corporate social responsibility regarding health. Yes, I know that these companies, for example, Talo constructed Bulisa Hospital and equipped it and handed it over to government. It's now run as a public hospital, and that was part of their responsibility. Regarding the recent Ebola outbreak, we have had meetings with the commissioner at the Ministry of Health, as well as with the Bulisa district health officials, to see what can be done about the Ebola response, and plans are already underway, and that is part of corporate social responsibility. We have previously also supported a surgical camp in Hoima area as Total, as part of corporate social responsibility. So there are many aspects that are going on in terms of corporate social responsibility that I don't have to name one by one, but we can give you more information out of here. Regarding occupational health, yes, I agree that occupational health needs more to come out more in the limelight. It's also partly because the current people trained in occupational health maybe are also silent about it. They don't make too much noise. I'm a physician by training in internal medicine, and I did the training in occupational health online. And I'm part and parcel of occupational health specialists in the country, but it's not given as much limelight as the other specialties in public health and in medicine. So I encourage the specialists in the room here to do a little more work on that, because when we assessed clinics in the country, as I mentioned in my presentation, we couldn't find a single occupational health clinic, even in Kampala, that meets standards for oil and gas industry. And that is one room for investment, one place that we should consider to develop. Regarding, we also contacted the Ministry of Gender, Labour and Social Development, specifically the Occupational Health and Safety Department in that ministry, and we discussed in detail. I don't think I need to go into the details here, but that is just a step towards getting more services in occupational health and safety in the country. Why there was a question concerning these medivacs to Nairobi. I must say that yes, sometimes the medivacs are because of an individual patient's request, because we know patients have the autonomy to choose where they want to be treated. So if I come from France and I want to be treated in France after I've got a major incident, nobody should stop me, because it's my right, it's according to medical ethics. But many times we have also assessed the facilities, just like Dr. Pierre mentioned, facilities for intensive care unit, facilities for more advanced care, and these are still lacking in terms of standards for the oil and gas industry, and that is another room for improvement. I think so far on our list we only have three hospitals that meet standards currently, and there's a lot of room. We are anticipating that the new Mulago hospital, the renovated one, will meet standards. I think that's all I have to say. Thank you very much.
Okay. Thank you very much. Now Nambiru, do you have anything? Okay. Ernest, you will be the last.
Dr. Mukasa was concerned about the fact that we only have expatriates coming in to do the hardcore, the drilling and petroleum, work that is currently happening in the sector. And I just want to shed light on how the training is being handled. First of all, we have the National Oil and Gas Policy, of 2008, and it recognizes the need to build capacity of Ugandans as one of the objectives. So coming from the policy, together with Ministry of Education, we developed what we call a workforce skills development strategy and plan for the oil and gas sector. This strategy pointed us to the different levels of training that we have to undertake, the number of people that are required to be trained. So everything that is being done is done in line with this strategy. We've had a number of institutions established, training institutions, both private and government. From the government side, we have Uganda Petroleum Institute Chigumba, and this is looking at technical training related to petroleum. So there is a lot of effort towards training and certification of the different institutions to acquire the relevant oil and gas requirements in terms of accreditation and certification. So this is done gradually. We have seen over time a growth of career of Ugandans in these companies. And as we speak today, just to give you some statistics, we have about 280 people employed in the oil and gas sector, and 80% of those are Ugandans. These 80% cut across. I need to mention that at the managerial level, the percentages are still low. Why? Because we need to build this capacity. In the areas of petroleum, you know, the hard cores that we talk about, the petroleum engineers, it takes a little time. It's gradual for one to acquire these skills. And the approach we are taking is to upgrade the petroleum, the people who have done engineering courses, for example, we are taking them on to upgrade. There's been a rigorous training program that government has done, and we have over 200 officers within the different government institutions, Petroleum Authority, Uganda National Oil Company, Ministry of Energy, Uganda Revenue Authority, Office of the Auditor General, Ministry of Finance, that have been trained to make sure that they acquire these skills. But this training is ongoing. The ability to acquire skills to deliver on the technical petroleum skills is gradual and is going to be achieved over time. The expatriates we have, yes, we need them because the industry is still young, but we are seeing a gradual move from the expatriates to Ugandans occupying some of these positions. Thank you.
Thank you. The ED private sector, do you have anything?
Well, there was no particular question to me, but I think I would just add one or two comments. Really to thank the Honourable Minister, because one of my earlier concerns was how we relate the oil sector planning, investment planning, with the health sector strategic investment plans. And I think in the reaction from the Honourable Minister, part of it came through with the examples on the referrals that are being done, the investments, but also on the revolving fund, because I mentioned that at the beginning, Honourable Minister, you were not here. But I'm thankful to you that when you reacted, you mentioned something that is in the offing about a revolving fund for the health sector so that we can access credit, affordable credit, to be able to invest. But I think even as we think through inviting the private sector to invest more in these opportunities, we need to emphasize the 3 S's: the safety, the security, and the standards. I think government here is really going to help us. Honourable Minister, whether we are thinking transport, we think about these 3 S's. Health, the 3 S's. Even corporate social responsibility, you're not just going to pick drugs and throw them out there simply because you're doing it. We must pay attention to the 3 S's. I thought I should say this. Thank you.
Thank you very much. Ernest, and after you invited the Honourable Minister to give her opening remarks.
Okay. Thank you very much, Moderator. For us as Petroleum Authority, this is a very exciting engagement. because our role here is really more like a connector or kayungirizi, as they say. As we regulate the oil companies in our meetings and whatever, you can imagine as we are seated there, you have the chief medical officer of Total, or you have Professor Beachika coming in the meeting and they say all those complicated things they have said. I don't have a chief medical officer in the Petroleum Authority of Uganda. So today I'm really excited because they have met their colleagues. And as they send, people are responding. Of course, it shows that there is work to do, which we are all very eager and happy to do. But it also shows that there are opportunities that we can take and do. Because when they come to us and say, you know, the workers can't get treatment because of this and this, then we say, how do we get that done? But that's not PAU. As they are saying, the doctors who are coming are going to cost so much money, and we are saying, but that money is too much. In our mind, we're also saying, but can that money be earned by a Ugandan? And things like that. So there are the challenges, there are also the opportunities. So I'm really glad that we are talking about them now, and I have no doubt that we're going to be better people. And I was just sharing with the Honorable Minister here, it's extremely relieving to see that all the challenges that seem to be being brought up now, none of them has had an answer which says, well, we are going to think about that. No, all of them have had, this is what we are doing about it. This is what we have started. So you can see that it's actually a question of implementing and perfecting. Implementing and perfecting. So I think all of us are really in a very good position. The question that was asked for me is a bit diversionary from the objective of this conference, but I will still answer it. It was about how much you recover from an oil field by the moderator himself. The total resources in Uganda now are 6 billion barrels of oil, and as the presenter said, this is only in about 10% of the Albertine Graben, so the country has an opportunity to find more. But out of these 6 billion, only 1.4 is planned to be recoverable, and it's just around, that's 25%. So the worry is that of all the oil found in Uganda, the plan is to leave 75% in the ground, and that can be very worrying. But that's the oil industry. The range around the world, those who do very well, and this is in Norway, the maximum they're able to recover is about 60%, and that's after a lot of hard work and after a lot of producing the field for some time. They've reached there because they've studied this field as it is being produced. In Uganda, the fields are not produced yet, so we are yet to study them, and there's a possibility that when they are produced and we understand them better, these 23-25% will increase. The parts of the world that don't do well sometimes recover only 5 to 10% of the oil, and they leave 90% in the ground. This is very sad and unfortunate, and the obligation we have, the task that we have been given by the government, is that we work as hard and as much as possible to ensure that we get as much oil out of the ground as possible. And so as an authority, we're doing our best. I'm glad we're not at 5 to 10%. The planning is 23, but I can hear you loud and clear that there is more work to do so that we can also aspire to the 60%. I think that's how I would like to answer it without deviating too much. The final aspect is that somebody, and the Honorable Minister has mentioned the training in health and safety that is being done at Mbarara and at Makerere University. And I think there is also something about a conference that was talked about. The objective of this conference is not just for the oil industry to tell you what is required, but it is also for the oil and gas industry to learn what exists in the system that we don't know about. Because, for instance, that conference, it may be very important and useful for the oil and gas sector to participate in it, so that we can see how much more can be picked out to improve the interaction between the two sectors. The capacity building that is ongoing, certainly the industry does a lot of work in capacity building. It is pushed to do it. I have no doubt that they will be relieved to learn that there are some capacity building efforts that are going on in the country, and it will be easier for them to relate to those, other than thinking that they should be sending people all over the world all the time.
So I'll chair the first two, and he'll take over the third and the Q&A. Our next speaker is coming from New Plan, and New Plan is an experienced multidisciplinary engineering consultancy firm, and they are going to talk about their real experience as we are initially told. So I want to welcome them. Please, where's people from New Plan? And we have to keep time. You're very welcome, sir.
I'll be presenting with a medical doctor, Dr. Sonia. So in case I reach areas where I cannot pronounce the words, she will come in. What we are doing basically is acquiring land around 300 kilometers from Hoima all the way to Mutukula in Chotela, covering 10 districts, a distance of around 300 kilometers. And of course, the area is around 1,200 hectares. And we've been employing the employment has been varying around 800 personnel at the peak, but now we have around 300 personnel, but using a lot of casual laborers, and all these must meet the standards that we'll talk about. So our approach has been really to put a lot of teams on the ground at the same time to carry out all those assessments you can see there for us to achieve the objectives within the defined period. Now, how did we cope up? I've given the scope, and the issue is how did we cope up? I must say we never coped up 100%, maybe 60% by the grace of God. Maybe one time we'll reach 80%. Now, the issue is that we have to meet the international HSE standards while providing the service within the given conditions within the country. Now, these oil standards as presented by Dr. PL, he's a very good gentleman who really helped us. Some of them appear too stringent given the local market conditions. So they affect the staff, they affect the hotels, they affect ambulances, they affect vehicles. Everything that you touch, you must fulfill the HSE standards. When I'm managing this contract, my first obligation is to see that I meet the HSE standard, because if you don't, then the contract can be terminated forthwith. Now, ambulances. I'm glad I saw Dr. Byarugaba around. This is one area where we need a lot of investment, because they gave us the standard, 0 to 5 years, 4-wheel drive, paramedics, and all these other technical things. And I remember I ran to Ministry of Health to get a list of the ambulances, and I found some of them were not so young as required. And then we had to run around. Say for that time, the doctor helped us, Byarugaba, city ambulances. Now, even the city ambulance, and now I know now he has bought ambulances that meet the requirements, but by that time, most of his ambulances were not meeting the requirements. Some were not 4-wheel, others were not so young. So we had to really agree with Total that this is what is on the market. As the investors bring in more ambulances, allow us to use this. And they ably allowed. The challenge was one, is that, of course, if they don't meet the standards, the regular breakdown, the stand-down time, all these other things would affect us, and they affect the pace of the contract. So this is an area that we need a lot of investment, because you can see we're using around 800 people, but construction, of course, there will be many times that I know we are acquiring land for the camps, and each camp will have 3,000 up to 5,000 people. So from here you can draw an equation and see how many ambulances will be required.
Thank you very much, New Plan, for that experience. It was interesting. Our next speakers are coming from City Medicals and City Ambulance. We have Mrs. Isabella Birungi Yaruhanga, the co-founder and director, who is going to speak. I don't know if she's around. Okay, you're very welcome, ma'am.
I would like to take this opportunity to thank the Petroleum Authority of Uganda for a conference well organized. I think this is something that was, we can all acknowledge it is something that we needed. And if you can imagine, there is no one company that can do this work on their own. We will need a lot of collaborative effort amongst service providers, amongst hospitals. If anything, we really need to work together now more than ever if we are to meet the kind of standard that is expected in the oil and gas, but also the capacity that is expected at the height of the activities. We don't know if there is any one company that will be able to satisfy the need of the IOCs as we go along these projects. We do provision of emergency medical supplies and equipment from all the supplies that would be needed in the oil and gas. For those of you who have been part of these activities know that we would require a crash bag. A crash bag has an oxygen cylinder, has so many other equipment in it, in addition to the equipment that would be made available in an ambulance. So a crash bag, for example, would be a mini ambulance, okay? Meaning that if an ambulance is stopping somewhere, someone has got to move with this crash bag and they have got to be able to deliver almost the same quality of service they would have if the patient was in the ambulance. So as you can imagine, even the other people who are on different sites, at every level of distance or kilometers, they must have a first aid kit. And City Ambulance, of course, has needed to come up with a first aid kit that they can put together with, many of these supplies and equipment in them. If you can see, this is a picture of one of the new ambulances that we've just brought in, based on the standard, of course, of Total E&P. As you can imagine, this is very capital intensive, and it is not just an ambulance. The equipment, the specifications that come with all the equipment is just too, at times you think it is too ridiculous, but that is the standard, and we must meet the standard. Personnel, very many presenters have alluded to the fact that personnel have got to be qualified, and unfortunately we do not have a facility that trains these personnel, although we have been in talks with Total to actually come up with a plan to have a TOT so that we can get a team of trainers, and the trainers, of course, will be coming from abroad. The skill, the original expertise that is available here, we are not at ground zero. We have personnel who have very good skill. And for City Ambulance, we are using nurses, at the lowest cadre, a diploma nurse, but we are retraining these nurses to top up on the level of skill that they have. Also giving them the experience, on the road experience. As you can imagine, having the training alone is not enough. These people have to come in for orientation. They need to know how to use the equipment that is, on the ambulances. So, experience is also a very big factor. The medical certifications that are required of us, as you can imagine, Dr. Pauline said there is only one center in Uganda now that is certified to give AHA certificates. And all our personnel have got to travel all the way to Mbale to get this certification. I don't know how much equipment, I cannot make an estimate as of now as to how much will be required at the height of these activities. but all this equipment is servicing so many people, and it must be maintained and to meet the standard expectation. So we need a lot of support in this in regard to the calibration, the maintenance and servicing, of course, dedicated air ambulance services. I'm glad to know that Priority Air Ambulance is coming on board to set aside a standard medical evacuation airline that will be available both for domestic and international flights, and they're trying to meet the standards. We are partnering with them to provide the medical personnel that are required and the medical standard, and they will stand by us to provide the actual planes that are required. Of course, skilling. Skilling is a very huge gap, like many of the other presenters have said. We need a skilling facility here if we are to really make this work. The numbers that we have to move abroad are quite many, and the return on investment, I'm not so sure. Of course, this personnel remain with us, but in the short term, the expenditure is quite a lot. Thank you very much.
I want to call upon my co-chair to come now. My co-chair is Dr. Mark Kasumba. He is an anesthesiologist, and he will take on.
Ladies and gentlemen, good afternoon. Thank you for that overwhelming ovation that you gave me as I stepped up. Tells me that everybody is still alive and doing well. This is incredible, and I am glad to be sitting in this chair today. Thank you, Dr. Zerida, for chairing the first session. And we have one more presenter. How useful it is to know that I've forgotten my program on the other side. Talk of co-chairing. We invite PANAF Investments to come up and make their presentation. PANAF, the floor is yours.
My name is Joseph Kalanzi. I'm a medical doctor in the emergency medicine program at Makerere University. So I work in the accidents and emergency unit of Mulago Hospital and Kirudu Hospital. And I'm going to make this presentation on behalf of the PANAF Investment Group. And it's going to be a story about work in progress to establish a facility that could meet the standards for the agenda today. The PANAF Group is, I'm glad to say, a conglomerate of people living the diaspora, Ugandans living the diaspora in the UK, who have put together money to invest in healthcare, and luckily they came at the time where oil and gas was at the center of the agenda. So PANAF is a non-for-profit company registered in the UK with several holdings in Uganda. We have planned investments in the oil infrastructure projects, specifically in the Bunyoro-Kitara Kingdom, namely in Hoima and the Greater Albertine region. We're going to offer broadly three categories of services. The first one is the general medical services, like you have in any facility. That's pediatrics, maternity, internal medicine. We'll also offer trauma care, especially targeted at the oil and gas industry, and health and safety. We'll have some structuring for that. As well, we intend to support the development of emergency medical services by creating a structure that can support ambulance providers in the region. So establishing call and dispatch processes that all private providers and government providers can link in. Many times communication and coordination is a very expensive thing. So we believe we can contribute towards this by establishing a ground ambulance base that many providers can utilize, both aero and land. So we intend to set up an ambulance base as well as establish a helipad on top of the facility that would enable companies such as Kampala Executive Aviation to get good landing space with ability for them to change stock, restock, and things like that.
I beg your indulgence. Allow me to invite the four presenters who presented only 3 presentations to occupy the 4 seats to my left, and then I'll ask for only 8 questions from the audience. Do I have your agreement? I see a hand of objection on that side. Okay, may I invite the presenters, please?
My question goes to Dr. Kalanzi. That's a very exciting project. I had a few questions. One was the timelines. You said in time for the airport, but I don't know how long that will be. And then you mentioned a fully staffed sort of hospital with all the different specialities. What are your plans to staff all those different specialities, as well as what is the affordability of the hospital? The oil and gas people will be able to afford, but what about the locals in the area? What sort of price ranges are we looking at? Thank you.
A lot of talk has been presented on the clinical aspects of investment. Suppose I want to invest on tailored short courses which can address people who may not pay themselves. For example, food handlers, to talk about food safety, hotel workers, infectious disease control. Just those two examples. Is there, and these short courses, will have to be paid by somebody. And looking at the multiplier effect and the impact of training food handlers so that we don't get disease outbreak big,
Mention that we have capacity for biomedical services in the country. I've actually been in Bugunga, in part of these for Total E&P, Dr. Piel and Dr. Bachika. I've been there twice in these areas, and we have done a lot of work for them in their clinics. We also have a biomedical training institute, HRA, Ernest Cook Ultrasound Research and Education Institute. We started in 2004 to train diploma students in biomedical engineering. Now we have a degree program in biomedical engineering. And so far we have passed out our first students, our first graduates. We also have certified programs, actually, with RSTI, the ones in radiology equipment. And we also bring in other certified programs on board. So kindly, audience, don't go outside of the country to go to South Africa looking for biomedical engineers and technicians. And I think we are here and very capable to do this work. Thank you.
My question goes to Dr. Kalanzi. You have mentioned something about this facility. It has really tickled us as the IOCs. We're one of your target audience or target clients. So my question is, have you interacted with any of the IOCs living out SINOC, or do you intend to engage us in your development plan? Because right now we are doing a lot of health facility surveys. We are looking at facilities we have now and those planned for the future, and see how we can incorporate them into our management plans. So on the other side, I would really seek that you get on board with us and tell us your timelines so we can incorporate your good service you've told us you're bringing on board. Thank you.
Dr. Kalanzi, you made a good presentation. You may give me some answers, but also the authority in general. That hospital and trauma center, very exciting. But I seem to see something missing. However good the trauma center will be, however good the general services will be and specialist services, there will be those 20,000 and more employees who will get injured and eventually end up with one form of disability or the other. Where is the rehabilitative healthcare? They will be there, or we shall remember when it is too late. Thank you.
Thank you, moderator. I think it was only one question about the issue of standards. When I said we negotiated the standards, it doesn't mean they lowered the standards. We had to give a timeline and the action plan on how to meet the standard. So, like for the vehicles, we have intensively invested in buying new vehicles, and also pushing Makatel to buy new vehicles. For ambulances is the same thing. So negotiating doesn't mean lowering the standard. It means giving an action plan and putting that action plan into action. So that's what we did, and I think what is needed is more private sector players to come on board, such that when construction starts, at least for the pipeline, some of these things do not have to come from other international companies. Thank you.
Thank you, Engineer. Madam Birunji.
I think there was no particular question directed to me, but in any case, I will just give a few comments. Thank you very much for the information that you have given about the biomedical services being available. It is good to note, and it is also important that we understand the capabilities of the engineers that you have. I know this is information that the IOCs would be very happy to hear, and also they would need to understand what the experience is, the type of equipment that they've handled, and generally the ability to maintain and service the level of complex equipment that is required. I would also like to talk to Lawrence from St. Catherine, who talked about skilling and product development. Yes, it is important, but I think there are quite a number of people who come from the academia here. I think this is something that would really be given to them, to come up with the standard curriculum that is, of course, meeting the standard, both international and local standard, so that we can follow the same guideline, especially if we are enlisting the same level of training. So across the board, of course, that is expected that we will have a curriculum, and you know, it will meet exactly the same, have the same scope across the board, and also be giving the same level of certification that is required. Yes, Dr. Alex also mentioned something about food and safety. Like I said, City Medicals is one of the companies that has been approved by Total to do medical screening for food handlers. However, yours is really about the training of the food handlers, and I believe that is a welcome concept. We are talking about pre-hospital care, and I think training is a very important issue. So please discuss it and come up with something. I know so many service providers would be interested in something like that, so that as people actually come in to do medical checkups, we are not faulting them for being sick, but we actually are just doing something that is routine, but in actual sense they are informed, they are aware of how to take care of themselves. So that's it.
Thank you very much, Birunji. If I may say so, that Makerere University is running a bachelor's of biomedical sciences or something like that. They're training biomedical engineers actually at Makerere University. They have a thriving society, and this society has a meeting that it holds twice, or rather once every 2 years, and I'm an associate member, so I'm also advertising, you know. Can I encourage us to generate engineers in Uganda? Dr. Kalanzi, we need you here.
Thank you, Dr. Mark. I also don't seem to have many questions, but I'll look at the ones that were addressed to me. But thank you again for your interest in the project. When this project was first introduced to us and we were told that it was a non-for-profit project in the oil and gas industry, it was very perplexing, because it said, non-for-profit? How big is it? 450 beds? It didn't connect. And yet the person, the CEO, primarily wanted it to be for the people. That was the objective. It says the primary objective is I want the people of the region to have health care. So we had to work around that ethos, and so our main idea of how to support it is sort of like a Robin Hood model. I'm not saying that IOCs are the rich, but there's fund pooling through the IOCs and the insurance that comes with the service industry in oil and gas, and hope that can give certain accessible money that can subsidize care for the general public, you and I. And so that's what we're trying to create as a model. I must say we've not had an opportunity to meet with the IOCs just yet, just to respond to Isaac's comment about engaging the development partners through the IOCs, but that's the next step. We've already had engagement with the Ministry of Health, primarily to ensure that we fit into the health sector plan. As you're aware that there's no facility of this level in that region, and so we believe we can support the Ministry of Health in that arena, but because it's for the public, the services have to be able to meet that catchment area. So we're finding ways to discuss how it can meet both the greater good for the public as well as the select need of the oil and gas industry. So you're very welcome to join us as we come up with this model, but that's the primary objective. To respond to Dr. Stanley Bubikire's comment about rehabilitation, you're spot on, especially with emergency care and injury and trauma. The continuum is scene care, safe transportation, quick and definitive emergency care in the emergency unit, definitive care in the ICU operating theater, and finally rehabilitation. So without rehabilitation, the work is done halfway. And so rehabilitation is definitely part of the structure. I just didn't mention it as a unit, but we have plans to introduce or strengthen rehabilitation services in the region. But that's definitely something that we've considered, especially since we're dealing with possible trauma and injury. Responding to I forget your name, Helen. Thank you very much for your comments. You had a question about the timelines. Yes, the timeline of 2019 to 2021 is extremely ambitious. We basically wanted to make sure that by the time the first group of foreign workers are coming in, we're ready. So we're working with that timeline in mind. I'm sure it's going to change a little bit, but you have to aim high, and then you can hit down. If you aim very low, you'll definitely meet it, but you'll not meet the standard. So we're working very hand in hand with the Petroleum Authority to make sure by the time you start business and the biggest numbers of people are coming in, we are ready to meet that demand. In terms of staffing, like I said, because we intend to meet, our big objective is to meet the needs of the public. We've already consulted with the Ministry of Health and have gotten their staffing standards, and we're trying to create a staffing scheme alongside that of a specialist hospital. Your question would then be, where would you get the people that will work in this hospital? Shall we deplete everyone from the public hospitals? And the answer is that's a possibility, but we're hoping not to do that. What we're hoping to do, on the other hand, is select a few people that are interested in the areas of care that we've shown you and take them through skilling. We've already had discussions with the UK government on taking a few people there or bringing some experts down here to start skilling up some of the people that will be the leaders in these units as we wait for the actual opening of the medical service. So again, those that are specialists or intending to be specialists, it would be nice for us to start having some engagement to see how we can prepare in time. And on a more sustainable basis, like I mentioned, it's going to be partly a training facility or a training site, the same way you see Mulago Hospital as a training site for specialists of all cadres, doctors and nurses and paramedics. So we're hoping this will be an extra training site for the country, so that those that would then target to become specialists in those areas can come and do their training from there. And along the way, we'll have more and more specialists. The next question was to do with affordability. Like I mentioned, we're looking at the Robin Hood model. We will not rob from the oil and gas, but we will find a way in which their resources can somehow be used for the public. I'm not saying we're going to be thugs. Dr. Alex mentioned something about food safety and training. Again, the training site what we're building is not going to be dedicated to particular trainings per se, but hopefully it will, now it's about evidence-based research and training. So we'll set up a facility that can accommodate forms of training, and then the experts in those areas can come and set up camp there, for lack of a better word, and train to meet the demands of the area. And finally, I had a question from Lawrence about capacity building and first aid. This one is not something I can answer per se, but around the first aid area, the Ministry of Health through the Department of Emergency Medical Services has first aid as part of its mandate, and I've already had discussions on establishing a national curriculum on first aid. So maybe you want to follow up with the Ministry of Health and find out where they've reached with that curriculum, but there will be there are plans to develop a national standard for first aid. I think those are the questions I was asked, so thank you very much.
Thank you very much, ladies and gentlemen. A round of applause to my panelists. I just want you to focus on the screens in front of you, and you'll notice that on slido.com, this interaction is ongoing. The questions are being asked by yourselves, and responses are coming from you as well. I would like to thank everybody for all your attentive attitude has been very positive. It has encouraged my presenters to express themselves and to share their experiences. Thank you very much, ladies and gentlemen. I hand over to the organizers.
Thank you, Dr. Kasumba. Another round of applause for Dr. Mark Kasumba and his co-chair, Dr. Zerida Muinda. And to our presenters, please take your seats. Thank you very much.
So the next presentation is on a public-private partnership, and largely it is how can we revamp, or how can we improve, or how can we upgrade the health service delivery in the oil and gas region through partnerships, and how can the private sector partner with government. So allow me to call Dr. Timothy Musira, who is the Assistant Commissioner Health Services, Private Sector Coordination, to come and share with us his message on how we can improve on partnerships. So thank you, Dr. Timothy, you are most welcome.
Good afternoon, ladies and gentlemen. Good afternoon, ladies and gentlemen. One of the most difficult things is to talk to people and to have a dialogue with them after having such a nice meal that has been given to us. So I have to try and get a mechanism by which I can keep you awake for the next 30 minutes. But also I'm following on giants who have spoken about the topic. In the previous speakers, you may have heard talked a lot about standards. Standards is a theme that was coming out all the time, and I think that was important. What that means is that we may have, our next session will be on health and standards and safety. It's really important that that is given the treatment it deserves, especially for the oil and gas health services. It is so important that that is done. I'm not going to attempt to repeat what the other speakers have talked about, because they've done it all. And I'm so unfortunate to follow them, but I'll try and make sure that I say the right things. I think the morning presenters from Ernest, Pauline, and the rest of the speakers, they did talk about the opportunities that are available within this space for the private sector. What are public-private partnerships? We've been talking about this for quite some time. Public-private partnerships are basically a risk-sharing mechanism. It is a mechanism by which two parties, one public and one private, agree to share either resources or risks or rewards in the investment that they are going to be doing. So please note three words. There's sharing of resources. There may be intellectual resources. There may be financial resources. But you also share the risks, and you also hope you will share in the rewards. That is central to any structuring of a public-private partnership. A lot of times when we come into these partnerships, we tend to make the assumption that I'm not going to take on any risk. The other party should take on the risk and I should take on the rewards. It doesn't work like that. And why is that important? What that is important is that as investors, you need to understand what you are going into. There is a very big opportunity that you will make surplus, and you'll be able to tell your shareholders that I'm giving you some dividend, I've made some money from the oil and gas health services. But it's also possible that you may go and tell them we've made a loss and we don't have dividends. And this is so important in those who invest in healthcare. City medicals will tell you that they cannot wake up in the morning if the bank tells them that the equipment you bought using our loan does not have demand. The bank has no option to go to the market and auction it. There's no market for that specialized equipment. So even if you wake up in the morning and say, I'm a bank, City Medicals is not paying me back, can I take this equipment and go and auction it to recover my money? You don't recover it. It's not there. And the fact that there is that asset specificity in healthcare investment means that those who are going to lend you money assess your risk differently. So they price in that risk of asset specificity. So a lot of private sector players have been asking me, why is it so difficult for us to get credit? That's the reason. Your investments have no resale value. The other thing with healthcare investors, and especially the SMEs, that's why I was asking the small and medium-sized investments. Your bookkeeping and business planning is very poor. When an institution comes to your business and says, where's your business plan? How are your cash flows? And they want to assess you for credit. In many of these SMEs, you can't get that information. So you can't get access to credit. Simple as that. What is the role of the Ministry of Health and government in general in these partnerships? We are basically play an enabling function. Because government sets the legal and regulatory environment, and for public-private partnerships, you know that we have a PPP Act. If you want to invest using a public-private partnership model, please get the copy of the PPP Act. It is a free document online. Just to go and Google it, get the PDF, download it, print it, and read it. It's a small document. Then we have got the public-private partnership in health policy. That is also available, and you can get it. And it describes how Ministry of Health relates to the public, to the private sector as far as relationships are concerned. And it is categorized into 3 parts. It has a part what we call a public-private partnership, private not-for-profit institutions. Whatever that means, they make some profit, but the residual claimant for that profit is institutional. That's what they tell us. There is no firm that can survive in the market without making some profit. You just collapse. So even the PNFPs make some profit. Then we have what we called in the policy document private health practitioners. We didn't want to call them private for profit, because sometimes it's very difficult to demonstrate a profit motive in healthcare investments, although they do make surplus. And we did not want to demonize the profit motive because it's what keeps the world going. And then we have our very extensive category of private sector in health, which is called the indigenous and complementary medical practitioners. This is a very big group, and if you don't make laws and regulations for them, then you don't know how to deal with them.
The oil and gas sector has a number of economic linkages, including manufacturing, tourism, health, and agriculture, as earlier indicated. We all appreciate that the physical and mental health of the people cannot be compromised, as it directly impacts productivity. So in addition to doing the infrastructure, these aspects of health, education, and others are also being prioritized. I would like to commend the companies that have shared their experience today. I believe the participants have gained an insight into what it takes to provide the medical and health services in the oil and gas sector. As I indicated in the morning, these people who are already at it are the best spokespersons in this conference. You have no excuse for not trying to participate because you have heard that there are other people who are already participating. Participants are also aware of the standards which are required and where to get the details of this. And so I would like to thank the oil companies for having informed this audience of the standards that are required, the health standards that are required for this sector. At least many of you know these standards now, but more importantly, and I recall the Chief Medical Officer of Total, they did make reference of where you can find these standards. So the aspects that the private sector requires to take this forward have actually been made easier during this conference. Now, every business has its challenges, and we appreciate the journey that the service providers who made presentations here have taken and where they are now. I therefore thank New Plan, City Medicals and City Ambulance, and PANAF, which is in the pipeline, for really sharing your experience, because the people who are here have really picked it up. And I would also like to thank the licensed companies for supporting these service providers. I think City Medicals and City Ambulance did confirm here that Total has held their hand in order to reach where they are. So I would like to thank the licensed companies for that. The Honourable Minister of Health talked about the policies and plans which are in place to ensure that even as more medical personnel are trained and deployed, the ministry will have adequately equipped health centers where they can provide these services. So it's not just a matter of having the people trained and giving them skills. The Ministry of Health is working very hard to put in place infrastructure where these trained people can practice. This is very good news, definitely not only for the oil and gas sector, but for even the other sectors of the economy and for the whole country in general. So there is much more work to do going forward, and we have to do it together. As they say, if you want to go quickly, you go alone. But if you want to go far, you go with others. This conference has been put together so that we go together. And the objective of going together is so that we can all collectively go very far. So with those few remarks, I would like to conclude this conference and thank everybody once again for having made it a success. Thank you very much.